Dental impressions are an important source of information that can be shared between the dental practice and the manufacturer of an oral appliance or denture. For the manufacturing of a Panthera oral appliance, digital impressions must capture the complete dentition without deformation or duplication of the buccal, lingual, and occlusal surfaces of the teeth, the cervical margins of the teeth, and 3 mm of gum, at least the mesial third of the third molar when present, the free saddle to the retromolar cushion of the lower arch and to the maxillary tuberosity of the upper arch. A palatal impression is not required for the design and fabrication of a Panthera oral appliance. For an intraoral impression, a scanning procedure must be followed for optimal results. Each scanner model has its own particularities. Pay attention to the manufacturer's instructions. Be sure to remove as much saliva as possible from the patient's teeth with an air jet, as saliva drops and reflections can interfere with the result. The optical scanner uses a light beam to capture images. Eliminating direct light sources, such as the dental chair lamp, will prevent artifacts from appearing on the final result. Start scanning occlusally with the distal of the last tooth present from a top sextant, and then scan the occlusal surface of the posterior teeth up to the canine. From there, in a back and forth movement, oscillate from the lingual to the vestibular of each of the anterior teeth to the canine of the other arch. Then, continue on the occlusal surface of the posterior teeth of the other sextant to the distal of the last molar. Move the camera to the lingual of this tooth and scan the entire lingual of the arch to the lingual of the last tooth of the other sextant. Finally, move the camera to the buccal and scan to the last tooth of the other sextant. If an edentulous area is present, try to take as much detail as possible of the distal and mesial of the teeth adjacent to the edentulous area, as well as the gum as the camera passes. If there are free saddles behind the last tooth of a sextant, make sure to capture up to the retromolar cushion in the lower arch, or up to the maxillary tuberosity if it's in the upper arch. Adjust your execution speed by observing the visual on the scanner screen. Repeat the procedure from the lower arch after the upper arch is completed. Ensure the quality of the print by checking the items mentioned above. If some areas are missing or unclear, go over them again. The device should make the corrections. Before sending the STL file to Panthera Dental, remove any unnecessary elements. If it's impossible for you to do so, we will validate the quality of your files and the feasibility of making your case from the files received.